works really well. We just covered the spinal cord injury section, and as you can imagine, a lot of patients with spinal cord injury in the very beginning end up being very dependent for their transfers. You guys have learned transfers already a little bit, right? So this is how to help somebody transfer. Well, this is somebody who can't help you at all. It's going to be the safest thing you can do with that patient, and it's called a Hoyer. Hoyers you see in the clinic are electronic, so you plug them in, and that goes up and down. This is a hydraulic Hoyer, so when you take this handle and pump it up, see it raises. So the person's going to be here, and Steph has volunteered to be transferred. I did find out that the Hoyer sling is rated. All Hoyer slings are rated for poundage, and this one that we have is rated 600 pounds. So we could have done you. So, but anyway, just FYI. Okay, so patients in the clinic come in all different sizes. Okay, if you have a bigger patient, make sure that your Hoyer sling, this is going to be the sling, is rated for the poundage. It's always indicating it. Okay, standard is going to be like 300. This one's rated for 600, so it's a big price. Okay. Far as, let's see. Let's talk about the sling first. So have you guys gone over rolling and bed mobility already? Yeah. Did you do dependent rolling, or how to, if that person can't help you at all? Okay. So that's what this is going to be. Typically when I'm using a Hoyer, I'm going to have a helper with me. And if somebody wants to help, you're welcome too. So that'll be a technician. But with the Hoyer, that person's going to be completely dependent. So I'm going to have to roll them. I'm going to have to get the sling under them. And this is going to be the sling that I'm going to put under them. Okay. I like to think about it as, if this is my body, these are my legs. So these things go on the bottom. Okay. And when I get the person in the sling, I'm going to take these legs and cross them up. So there's no place for them to slide out. You'll see that. You can tell this is the inside, faces the patient. This is the outside because it has handles on the outside. Okay? These handles are going to come in useful when I have to sit the person in the wheelchair. So essentially, as I push them down with the sling into the chair, I'm going to pull back and make sure that the bottom's seated way back in the chair. Otherwise, they can slide out. Okay? Questions about that? Has anyone seen one of these in action before? Yes? Oh, you have? Okay. Well, good. You'll be a perfect patient then. Would you like to take your shoes off and jump up there? They're fine. Okay, the Hoyer has a couple of parts. Like I said, this pumps up, okay? And once I get the person up, to lower them down, there's a little release handle right here, and I can say that you just want to do it slowly. There you go. And that's really slow. The hydraulics on this thing are nice and smooth right now. And then once you get it down, clamp it off, and it should stop. When you have a dependent patient, let's say that she's had a spinal cord that's up at like C5 level, like super high, that means she's got no use of her arms at all. Right? So one of the things that I tell people to be very careful about is this part. This part can hit her in the face. She can't defend herself. Okay, so when you're working with somebody, putting a person in a Hoyer, make sure you have control of this at all times because they might not be able to defend themselves against getting hit in the head. Other parts of the Hoyer, there's locks. Okay, these locks on both sides to lock it down for safety. And then also there's this. It's a little. So right now it's closed, okay? This is going to be making it easy to maneuver the Hoyer, but when I have to put it around the wheelchair, I want to widen the base, so I just pull out and open it up, and doing that allows me to just pull right in so I can get the person in the chair. Okay, so everyone see that? And you'll get time to play with this too. So I'm setting it up, I'm here, then I'll start. Okay, you want to lie down for me? We didn't have this on video, so you can just stand over and have it available for you on the course page. Essentially, like I said, I want to have this be up top, and then I want to have this be like her legs. Okay. The only tricky part about using the Hoyer is going to be rolling it up, having her roll in one direction, putting it under her, and then having her roll the other way, and then unrolling it. Okay? So, what can happen is, if I want to set it up this way, I'm going to take this part on this side, up so it's about halfway. And what I'm gonna do is, bad about the text. Good. Let's see if I can pop this up just a little bit. Ordinarily, if I'm working with a bed, or I will be working with a bed that raises and lowers, I always like to have the height of the bed about or a little bit higher than the height of the wheelchair. That way I don't have to pump the person up very much more. I know exactly how high to go. So I'm just in the habit of getting this up. And what I'm going to do, a lot of times I'll have a helper, but if I don't have a, and you can cross your legs if you want to. Did you guys learn that for dependent? Okay, for dependent rolling, a lot of times if you have that ankle crossed over, if she's going to roll this way for me, it's gonna help her roll as we go. All I'm gonna do is I'm gonna go ahead and roll you toward me, and I'm gonna put the sling under you, okay, and then you're gonna roll the other way, or I'll help you roll the other way, okay? On the count of 3, 1, 2, 3, roll. This, okay, I want this to be positioned about there. Go ahead and roll that for me. Okay, let's cross your legs over in the opposite direction. Perfect, now roll it back the other way. You just have to help me at all. So, pretty good. She's about in the middle. That's going to be important, right? So it takes a little bit of practice to get it right in the middle. And if she's not in the middle, then we're going to keep rolling until I get there. Okay, as far as this is concerned, I'm going to take this, and I'm going to put it on one leg, sorry about the cold hands. This up here, and this one's going to go in this direction. Now I have a nice little sling, and she's not going to fall out of it. Okay, so everybody see that? And then with this, the only thing to worry about is the position here. I want my patient to be here. Okay, I don't want to set it up so that I'm this way. Okay, I want the person to be seated or lying in the middle, right here. Everybody see that? Okay, and then ordinarily when I'm doing this, I'm going to have a helper. Like I said, do you want to be my helper?
I'll switch with.
No, you're good. You just want to. I like to just have. Oh yeah. Okay. That's a good idea.
I'm not that type of doctor.
I usually like just keep a hand. I usually just like to keep a handle on this, and then as she's doing that, I'm going to lock her down. Okay, and again, I can raise them over this as need be, and I'm going to take the back piece, and I'm just going to hook it in here. Ordinarily, I like to have it so that she's not fully seated, fully sitting up. If she truly doesn't have any trunk, she can plummet forward in the Hoyer. Okay, so I want to have her a little bit, I'm on the lowest loop. Okay, and then this one, we can have one in the middle, one not. So yeah, you're dependent. You're good. So this is where it becomes important that we have a handle on it. Okay, once we get her, is that good? Yeah, that's good. You can put that one in the middle too if you want to. Yeah. Okay. Get that. Okay, so she's in there now, and my technician is going to always keep a hand on her and also help her with her head. She doesn't have a lot of head control. She might have a neck issue, if she really has a spinal cord issue. I also want to set this up, so the only thing I have to do is I'm going to pump her up. Okay, she's going to raise. We're going to turn, and then I'm right there to get to the chair. And then when she comes up, you don't need to use the handles. Okay? Ready? Yeah. Up we go.
Get your arm work out.
Yeah, and like I said, she good? Okay. So she's in there, she's in a sling. All I'm going to do is unlock. Okay, we're going to go forward this way. Together.
We got you.
It's all good. It's all good. You're good. Okay, up right here, open this, and then all the way back. And what Dr. Elon's going to do is go ahead and do that, and I like to lock her down. She's not going to go anywhere. And then it's moving. So Dr. Elon's job, that she did nicely, is to pull back on those handles. okay, and get her bottom seated back in the chair. It's still going down. Okay, and that would be it. When you leave a patient, if you transfer the patient with a Hoyer, perfectly okay to leave that sling underneath of them. Actually, nursing appreciates it very much, because that way they don't have to get it back underneath of them. Okay, so if I had to take her to therapy, one possibility would be to just keep these crossed, so I might want to hook them back up on the handles, so she doesn't fall out of the chair if need be. Okay? This is good for a completely